Hello, this is Dr.Pritesh Junagade. I am a Haematologist and Oncologist, meaning a specialist in blood diseases and cancers. Today I am going to tell you about a very common disorder in our society, especially India, which is anemia, which is also known as a patient having a low hemoglobin level, and this is a very common disorder. So the term anemia means your body is unable to deliver oxygen to the other parts of the body, and this itself causes many symptoms of anemia. So what are the symptoms of anemia? How do you detect, how do you know that you have anemia? The most common symptom is weakness. You feel tired. When you do your daily activities, whatever they might be, you feel more tired, you feel weak in doing those activities. This is the most common symptom of anemia. For example, if you live on the second floor of an apartment, you go there routinely, but suddenly you notice that for the last few days I am feeling more tired, I need to rest after one flight of stairs, and you are unable to reach your house within a set frame of time, then you might be anemic. Of course, there are other problems which can cause similar complaints like heart problems and lung problems, but common is a low hemoglobin. Other symptoms might be fatigue, meaning you don't feel like doing anything. Loss of energy is a very important complaint of many patients who see me for anemia. So after you think this might be anemia, the things to do next is to find why your hemoglobin is low. Before that, to detect your hemoglobin is low, you need to do some blood tests. Do you always need to do blood test? Yes. To detect low hemoglobin, a basic test like complete blood count is of utmost importance. So you can see your local doctor, he will examine you. On examination, he will have a look in your eyes, because low hemoglobin can be detected easily when your eyes look pale. Also, your nails are whitish, they look pale, and that's the way we can detect anemia or low hemoglobin in a patient who comes and sees us. So how do you diagnose what anemia is? You do a simple blood test called a complete blood count that gives you your hemoglobin level. A normal hemoglobin level in a male should be between 14 to 16 gram per deciliter. In females, it should be 12 to 14. If your hemoglobin is below those levels, you are anemic or your hemoglobin is low. Next, I will tell you something about the common causes of anemia. Why does a hemoglobin go low in a given patient? So, there are so many causes. If I discuss all, you might have to hear me for hours and hours. But I will tell you some simple and common causes of anemia. The first and the most important cause, especially in our country, is poor diet. You all know hemoglobin is formed in your red cells, which is formed in your bone marrow, which is like a factory. You need certain elements, certain vitamins, certain special substances to form a good hemoglobin. The common are iron, folic acid, and vitamin B12. So if your diet is poor, especially people having vegetarian diet who don't drink milk are prone for nutritional anemia, meaning anemia caused by poor nutrition or poor diet. So if your food is not rich in iron or vitamin B12, over a period of years you are prone to be anemic. And this is the most common cause of anemia for which people come and see me. The next common cause is unnoticed bleeding in your body. If you have obvious bleeding like piles, that can lead to anemia, especially iron deficiency anemia. There could be occult bleeding, meaning the bleeding is so slow, it's like a trickle and you don't notice it. But over a period of years, your hemoglobin goes low. This is called occult bleeding. It can occur through your back passage and you may not notice it. The next common problem in our country is hookworms or worm infestation in our stomach or intestine, to be more specific. Here the hookworm eats up your iron and hence your iron is low and you get anemia. There are other many causes of low hemoglobin or iron deficiency, but we might not go into the details as of now. The other common cause or problem is vitamin B12. Now remember, vitamin B12 is a very important vitamin for all of us. You get it only from animal products, meaning whatever vegetarian diet you are taking, you will not get vitamin B12 through it. So for vegans or strict vegetarians, milk is the only source of vitamin B12. If you are eating a non-vegetarian diet, then generally you will not be deficient. This does not mean that you all should have non-vegetarian diet. All vegetarians, in spite of having a good veg diet, if they take good amount of milk, they will never be vitamin B12 deficient. So I have discussed few common causes of anemia, which is nutritional anemia, which is the focus of our talk today. Next, we will come to the treatment part. Treatment is very important. Many patients feel that just by taking good diet, they will raise their hemoglobin from a certain level to a normal range. That is not right. Diet, yes, it's important, but it will take a long time for your hemoglobin to come up. So you need some specific treatment for your low hemoglobin. So what are they? If you have been diagnosed with iron deficiency by some special test which your doctor might suggest, we will give you iron supplements. The iron supplements, most of you have taken iron supplements. A common problem with iron supplements which the patients complain is that they get tummy upset or gastric upset, meaning they feel weak or sick, they feel like vomiting many times. And we normally tell patients to take iron tablet before they have food. So iron tablets can cause problems, but over a period of few days, the problems might settle down in some patients. If it is too bad and you don't get any relief from the tablets, you can take the tablets with food. Of course, that will reduce the absorption of iron from the tablet, but you might have to take it for a long time. Next important thing when you take iron tablets is to remember that don't drink milk or any milk products with the tablet 1 hour before or 1 hour after taking the iron tablets. Also, we know the age-old thing that vitamin C increases your iron from the stomach. So, drinking say orange juice or having a splash of lemon in your food will increase the iron absorption from your diet, and that will not lead to iron deficiency. Also, some people have habit of drinking tea just after food. That is not good for iron absorption, because tea contains tannin which reduces the iron absorption. So, never drink tea, coffee after your food. So these are the common things we do for iron deficiency. After giving iron tablets, 10 to 20% of patients do not respond or the hemoglobin does not go up. These patients might have a condition called malabsorption, meaning the iron you take is not absorbed from the intestine. There are certain diseases which leads to this. In such conditions, we might have to give iron through your veins, which is called an intravenous iron intake. So doctors might prescribe you an iron injection to be taken say twice a week or thrice a week depending how low your hemoglobin is. Almost all patients will respond to this therapy. The vitamin B12 deficiency which I told you earlier is treated by giving certain injections into your muscles that might be given every alternate day for 5 or 10 injections, again depending how low your hemoglobin is. Following that, we can give you some tablets of vitamin B12 or which is called methylcobalamin to increase your vitamin B12 level in your body. So if you take this, we again call the patient after around a month or 3 weeks depending what your hemoglobin was and recheck that hemoglobin. If your hemoglobin is become normal, that is a good sign and that suggests the treatment is successful. In some patients, the hemoglobin does not go up, and in these patients we need to find some other cause of anemia. There are plenty causes of anemia, almost 300 causes of anemia. So today in this discussion we discussed about anemia, the common causes, the nutritional deficiencies, how to treat it. The last thing which remains, and I think is most important, is what are the common foods we eat which contains iron and vitamin B12. Well, the iron rich foods for a vegetarian are dates like khajur. You can soak it in a bowl of or a cup of milk and have it 5 days a week. Then jaggery and groundnut combination, which is commonly in our country sold as chikki or a laddu, that is a very good source of iron. Then spinach along with dill is a very good combination of a rich source of iron in our diet. You can also take dry fruits, which is quite rich in iron. And lastly, for those parents who don't like the children to take chocolates, chocolates are rich in iron too. So now you don't need to eat chocolates just because I've told you it is rich in iron. But if you have a good balanced diet, a healthy lifestyle, and you know what you are eating, you will never get anemia due to nutrition deficiencies. So thank you for your patient hearing. Thank you.